Hello everyone. So this class is again about the anatomy of spinal cord. So this is part 2 where I will be talking even more in detail about the spinal nerve formation, then the cross section of the spinal cord, mainly the internal features, okay, and how the sections are seen in different levels of the spinal cord, and also about the white matter and the grey matter area of the spinal cord. Let's start with the spinal nerve formation. As I told in my previous video, how the nerve is formed and how many pairs of nerves are formed in the spinal cord. So there are 31 pairs of spinal nerves which are attached to the spinal cord segment by two roots which are called as, so this is the posterior aspect of the spinal cord, this is the anterior aspect. So they are attached to the spinal cord by two roots. So this is the posterior root or the dorsal root, and this is the ventral root. So I had also told that ventral root has the group of nerve fibers which are motor in function, also known as efferent fibers, moving away from the central nervous system, passing through the different parts of the body, supplying mainly the skeletal muscles of our body for movement. The posterior root carries the afferent fibers which are going towards the spinal cord, that is carrying the different sensations of our body, which includes pain, touch, temperature, vibration, 2-point discrimination, proprioception. So different types of sensation which I will be talking about it later. So those travel through the posterior root and enters the spinal cord, and then they are segregated and sorted out. So there is a unique feature of the posterior root. There is one special feature in the posterior root which is called as dorsal root ganglion or the spinal ganglion. So you all know what is ganglion means. Ganglion is a singular and ganglia is plural. Okay. So you know that the neurons or the cell bodies of each nerve are present in the central nervous system, either in the brainstem or in the spinal cord. Okay. And what their fibers, their axons are moving throughout our body. But in our body there are some cell bodies or some neurons lying outside the central nervous system, that is brain and spinal cord, and these are called as ganglia. Okay, so one such ganglia is the dorsal root ganglia because it is connected to the dorsal root or the posterior root. Okay, throughout the spinal cord segment there are pairs on either side are the ganglia. Since it is in relation to the dorsal root, they are called as dorsal root ganglia, or also called as spinal ganglia because it is in relation to the spinal cord. Okay, so these ganglion have groups of cell bodies having peripheral process and the central process. The peripheral process carries the sensation move towards the cell body, okay, and the central process carries the information and enters the spinal cord. Okay, so again there are group of cell bodies having peripheral process and the central process. The peripheral process are connected to the sensory receptors which are present in our body. They carry the sensory information, enters the ganglia, the neuron, okay. Then through the central process, the informations are carried towards the spinal cord. So this is one of the features in the spinal nerve formation. So these afferent fibers and the efferent fibers which are traveling through the dorsal root and ventral root respectively, they join to form the spinal nerve. On either side, they join to form the spinal nerve. Now, the spinal nerve is a mixed nerve having both afferent and efferent fibers. But ventral root is purely efferent and dorsal root is purely afferent. Both join to form the mixed nerve called the spinal nerve. Then, after exiting out through the respective intervertebral foramina, the spinal nerve immediately divides into two branches. So one is called as dorsal ramus. The other one is called as ventral ramus. So ramus again is singular, rami is plural. So this dorsal and ventral rami, again they are mixed, which are branches of spinal nerve which are formed after exiting through the respective intervertebral foramina. So these rami supply our whole body. So dorsal ramus passes posteriorly and supplies the muscles of the posterior aspect and also carries the sensation from the posterior aspect of the body. Then ventral rami, which is a bigger branch, supplies anterior lateral part of our body. So this is about the spinal nerve formation. Okay, so dorsal root, ventral root join to form the spinal nerve. Then again they divide into two branches, dorsal and ventral rami. Now moving on to the cross section of the spinal cord. So if you take a section of a spinal cord, what all the features, internal features you see in the spinal cord. So you can see there are two main features in the spinal cord which are seen both externally and internally. So there is a small sulcus, okay, which is not very much deeper exactly at the midline. So this is called as posterior median sulcus, okay, posterior median sulcus, because the sulcus is not very deep, and anteriorly there is a deeper structure called as anterior median fissure. So this is posterior median sulcus and this is anterior median fissure. So this fissure is obvious externally, so that in the spinal cord you can identify whether this is the anterior aspect of the spinal cord or the posterior aspect of the spinal cord. So it can be recognized by these two features, that is, since anteriorly the fissure is deeper, so you can identify and tell that this is the anterior aspect of the spinal cord. Then centrally, on freshly taken section of the spinal cord, you can see the center is the grey matter and periphery is the white matter. So this grey matter, the it is head-shaped horns of grey matter which are connected by a thin commissure called as grey commissure. So this is the one connecting the one horn on the posterior aspect, the other horn on the anterior aspect. So this is called as posterior grey horn. It's written here, posterior grey horn or column, okay, and this one which is lying anteriorly is called as anterior grey horn. So these two horns or columns are connected at the center by a commissure called as grey commissure. So in the grey commissure there is a canal called a central canal. So within the central canal there will be flow of cerebrospinal fluid. So this central canal is connected to the higher center, to the brainstem, to the ventricles. So this central canal divides the grey commissure into two areas. One lying anterior is called as anterior grey commissure and posterior one is called as posterior grey commissure. Okay, so posterior grey horn, anterior grey horn. This is the grey commissure. Within that is the central canal, which subdivides the commissure into two areas, anterior grey commissure, posterior grey commissure. Now, the white matter which is surrounding the grey matter. So, basically the grey matter has groups of cell bodies with the emergence of the axons which are not myelinated. So, that's why they appear grey in color. The surrounding is the white matter where the axon fibers from those cell bodies will exit out or enter. So they are highly myelinated. So that's why they appear whitish in color. So that's why that area is called as white matter. So again, white matter, there are three parts. Okay. So this one which is lying posteriorly in between the median sulcus and the arising of the posterior root. So this area is called as posterior white funiculus, okay, posterior white funiculus, okay. Then in front, again in between the anterior median fissure and the emergence of the or arising of the ventral root, this area is called as anterior wide funiculus. Okay, anterior wide funiculus, and the area between the posterior root and the ventral root, so this area is called as lateral wide funiculus. So three areas: posterior wide, lateral wide and anterior wide funiculus, or also called as column. Okay, so in order to differentiate between the grey and white matter, so grey area will be called as horn and white area will be called as funiculus. So this is the internal feature of the spinal cord. Now here I have drawn the section, the cross section of spinal cord at different level. So you know that there are four levels: one at the cervical, thoracic, lumbar and sacral. So how to identify that this section is taken at the cervical level, this at the thoracic or lumbar or sacral? So you have to keep in mind the amount of grey matter present at different levels. So the amount of grey matter is, it depends, okay, it depends upon the amount of muscle supplied at that segment. Okay, so I had told in the previous video that when you see the anatomical feature externally gross, if you see there are two enlargement, one at the level of cervical, the other at the lumbar, cervical enlargement and lumbar enlargement. And the reason behind that I had also told that these are the two areas where the nerve fibers are more, because those nerve fibers are supplying the muscles of the upper limb and lower limb. So the muscles, the skeletal muscles are more at the upper limb and the lower limb. So you will see the group of nerve fibers are more in number at these two areas. So since the muscles are more, okay, so those muscles are supplied by different nerve fibers. So the amount of grey matter also will be more at the cervical region and lumbosacral region. Okay, so this we have to keep in mind. Okay, so this will help you to identify at which level the section has been taken. Okay, so the amount of grey matter is more at the level of cervical region and lumbosacral region. Okay, then, so this is the cervical spinal cord section. So you can see at the anterior aspect, since this is the anterior horn which give rise to motor fibers supplying all the muscles of the upper limb. Okay, so it will be very broad, and you can also see they have an oval appearance, and white matter area is also more. Okay, because all the nerve fibers are starting from there. Okay, so the white matter will be also more in number, and even the grey matter with a broad anterior horn. Okay, so this is the section at this cervical region. The next is the thoracic region. Okay, so the grey matter is not in greater amount, but one more unique feature you have to see is the presence of an extra horn along with posterior and anterior is the lateral horn, which is present in the thoracic region. So what is this lateral horn, which is not seen in every section, only at the thoracic region from T1 to L1 and also at the lower sacral region. Okay, so the reason I will tell you now. So you know that our body is also supplied by autonomic nervous system, which includes sympathetic and parasympathetic. So sympathetic arises from thoracolumbar region. Okay, so the sympathetic nerves arises from thoracolumbar region, which extends from T1 to L1 spinal cord segment. Okay, and parasympathetic is craniosacral. So some of the cranial nerves have parasympathetic innervation, and also the lower sacral region S2, S3, S4. So those even have the parasympathetic innervation. Okay, so this sympathetic and parasympathetic have their cell bodies in the thoracic and the sacral region. So the T1 to L1. So if you take a section from T1 to L1 along with anterior and posterior horns, there is one extra horn which is called as the lateral horn, where there are group of cell bodies which is giving rise to sympathetic innervation. So they travel through the ventral root and then supply the whole internal organs in our body. Okay. So these cell bodies and the nerve fibers are called as preganglionic nerve fibers. Okay, preganglionic nerve fibers. After exiting from there through the ventral root, then they relay or synapse in the sympathetic ganglia, and then the postganglionic fibers arises, and then it is supplied to the effector organ. Okay, so this is one of the feature if you take a section at the thoracic region. Now coming to the lumbar, again when you see here in the lumbar region, the grey matter is more in number because there are more fibers supplying the lower limb muscles, and when you see the white matter area slowly decreases when compared to thoracic and cervical. The white matter area is becoming less, the amount is becoming less. Now coming to the sacral region, you can see the white matter is totally, it is minimal, grey matter is more. Okay, and along with that, if the section is taken at S2, S3, S4 level, you can see a lateral horn here which is giving rise to parasympathetic nerve fiber, which is called as pelvic splanchnic nerves. Okay, so that parasympathetic nerve which are arising in the sacral region, they are given special name called as pelvic splanchnic nerve. So this is how you identify each section at different segment, whether it is cervical, thoracic, lumbar or sacral. Grey matter area in detail. As I told earlier, grey matter consists of groups of all cell bodies of the neurons. Along with that, they have blood vessels and some of the supporting cells which are called as neuroglia. So, and I had also told how the grey matters are divided into posterior horn, anterior horn, then there is grey commissure, and at thoracic and some of the sacral region also have an extra horn, the lateral horn. So now we will know what are the cell groups, the main cell groups which are present in each horn. Now coming to the anterior horn, which mainly has the neurons concerned with motor in function. So for the practical purpose, they have the cell groups which are present in the anterior horn has been divided into three: the medial, central and lateral groups. So the medial groups have cell bodies and they are distributed and they are present almost in all the spinal cord segment. Okay, so present throughout the segment in almost all segments, and they have group of cell bodies which are responsible for innervating their axons, which are coming from there. They are responsible for innervating the muscles of the neck and trunk, okay, which also includes intercostal muscles and the abdominal muscles. Okay, so those nerve fibers are situated mainly in the medial group. Then coming to the central group, which are minimal in number, okay, the minimal in amount, and basically they are present in some of the cervical region and in the lumbosacral region. Okay, so they are not present throughout the segment. They are mainly seen at the cervical and lumbosacral region. Okay, so these central groups have groups of cell bodies, especially at the cervical region. There are two nucleus, okay, called as accessory nucleus and phrenic nucleus. So accessory nucleus, so this group of cell bodies are mainly distributed from C1 to C5, I'm sorry. Okay, so accessory nucleus. And phrenic is from C3 to C5. So which are mainly present at the cervical region. So the accessory nucleus, so these group of cell bodies which are coming from C1 to C5, okay, so they are responsible for innervating the muscle, that is the sternocleidomastoid and the trapezius. Okay, and the axon fibers which are originating from these nuclei are called as spinal accessory nerve. So accessory nerve is the 11th cranial nerve which has two parts: cranial part which is arising from the brainstem and spinal part arising from C1 to C5. Okay, spinal accessory now, and you know that what are the muscles it supplies, the sternocleidomastoid and trapezius. Then there is one more nuclei called phrenic nucleus, which give rise to phrenic nerve supplying the muscles of the diaphragm for respiration. So they are present from C3 to C5 segment. So these are the two nuclei which are present at the central area of the cervical region. Then the lumbar region also have, lumbosacral region also has a central group which give rise to lumbosacral nerve. So their area of distribution is unknown. Okay, so mainly know this one, the accessory and the phrenic nuclei. Now coming to the lateral group, okay, so again they are mainly present at the cervical and the lumbosacral region, and the group of cell bodies situated at the lateral area are mainly responsible for innervating the muscles of the upper limb and the muscles of the lower limb for movement of upper and the lower limb. So this is about the anterior great horn having three groups, how those groups are distributed. Now coming to the posterior horn, again there are different groups of cell bodies. So practical purpose they are divided into four groups. Among these four groups, the first two which I am mentioning are present throughout the spinal cord segment, and the other two are present only at the thoracic and some parts of the lumbar region. Okay, the first group which are present at the tip of the posterior horn, okay, they are called as substantia gelatinosa. Okay, so this is present throughout the segment, and the group of cell bodies, they receive afferent fibers. So you know that posterior root has afferent. Okay, so they receive afferent fibers which are concerned with pain, touch and temperature. Okay, so they get the fibers which are associated with pain, temperature and touch. The next group, anterior to the substantia gelatinosa, again they are present throughout the segment. They are called as nucleus proprius. Okay, nucleus proprius. So these have cell bodies which are associated with the sensation of movement and position, which is called as proprioception, then 2-point discrimination and vibration sensation. Okay, so those sensation which passes through the posterior root, those fibers carrying these sensation, that is proprioception, 2-point discrimination and vibration sensation, they come to the posterior white column or funiculus, and from there they synapse with the nucleus, the cell body which are present in the nucleus proprius area. Okay, so the nucleus proprius receives fibers from the posterior white column which are concerned with proprioception, 2-point discrimination and vibration sensation. Now the other two cell groups which are present situated at the base of the posterior grey horn, okay, so these are not present throughout the segment. They are mainly seen at the thoracic and the lumbar region. Okay, so the medial area of the base is occupied by a group of cell bodies called as nucleus dorsalis, or the other name is Clark's column. Okay, nucleus dorsalis or Clark's column. So these receives fibers which are concerned with muscle spindles and joint spindles, the proprioceptive spindles. So they are concerned with that, and they are mainly present at the thoracic and the lumbar region. So they say that they extend from C8, okay, the last cervical, C8 to L2 or L3. Okay, the lateral to that there is one more group of cell bodies called as visceral afferent nucleus, which are distributed from T1 to L3 segment. Okay, so these receives afferent fibers from the visceral organs. Okay, so that's why it is named as visceral afferent nucleus, which are associated with sensation coming from the visceral organs. So this is about the grey matter area of the spinal cord, about each horn. Okay, and the thoracic region have an extra horn called as the lateral horn. Okay, so as I already told, lateral horn, they have group of cell bodies which give rise to preganglionic nerve fibers which are associated with sympathetic innervation. Okay, and at the sacral area, S2, S3, S4, even they have lateral horn. So they have group of cell bodies which are parasympathetic innervation. Okay, and they have given a special name called as pelvic splanchnic nerves.